Hello guys, how are you? Hope you're doing fine. Welcome to our channel Last Minute Pharma, your exam antidote. Today we are here to start with a new topic that is your anticholinergic. Okay. So initially we have already finished about the cholinergic nervous system. Okay. We started with the drugs which are related to the autonomic nervous system and we have finished the cholinergic. Now we are going to move ahead with the anticholinergic drug system. Or what are the different kinds of anticholinergic drugs? We try to understand in detail about the mechanism of actions, what are the uses, what is the interactions in a very easy format. Okay. So now we have shifted our mode of teaching in the form of like I used to usually take in lectures, right, in the format of your and like using the board and marker. Today we like from today we are going to be shifting to the like using the software by using the different kind of software we're trying to make the videos so that we can increase the frequency of the videos and try to complete the syllabus as fast as possible. Because many of you even message me that exams are coming and that syllabus is not in the like up to the mark or like it's not like the frequency is very less. That is obviously because offline takes comparatively more time. But then this as like we have this format, we can try to make it more interesting for you guys by using the slides and teachings. Okay, so fine. Let's move ahead. So, what are the learning goals of today's lecture? We are going to understand what are different kinds of anticholinergics. Then we are going to understand what is the mechanism of action. Very interesting mechanism of action. Okay, so it's just like how we are going to ghost the acetylcholine. Okay, so you might be knowing what is the meaning of ghosting, right? Now it is very common. So then later we are going to understand what are the uses of it, what is the good roles of your acetylcholine, of your atropine, you can say, of your anticholinergic drugs. Then we are going to see what are the side effects of this drug or what are the adverse drug reactions of this drug. And then we'll also understand about the toxic love affairs of this particular anticholinergic nervous system. So, in the initial classes, we have discussed about the autonomic nervous system. The autonomic nervous system, we are mainly classifying into two types, right? That is your sympathetic nervous system, and other one is your parasympathetic nervous system, right? Right. So, those drugs which are there, they are going to activate your sympathetic nervous system or your adrenaline, right? Mainly your adrenaline, which is there. This is also called as fight and flight. Already we have discussed this. I'm just revising it a bit. This is also called as fight and flight system, which is going to help in facing the situations, facing a dangerous situation. So it's mainly going to cause activation. Okay. So for that, you are mainly going to have your hormone or you're going to have your neurotransmitter, that is your adrenaline, which is responsible for the activation of the sympathetic nervous system. Similarly, parasympathetic nervous system, which is also called as the rest and digest, which is also called as the rest and digest. Okay, here we are having the acetylcholine, which is going to activate this system, this particular system, right? So those drugs, okay, so we are classified based on like the drugs which are used in autonomic nervous system, right? So those drugs which are going to activate the parasympathetic nervous system is called as cholinergic drugs. These are called as cholinergic drugs. So these are mainly going to activate your parasympathetic nervous system. That means it's mainly going to help in rest and digest. Okay. So those activities or those changes in the body which is going to help in rest and digest. Okay. Or those drugs which are going to cause the activation of the parasympathetic nervous system are called as cholinergic drugs. Similarly, the exactly opposite of it, that is going to be called as your anticholinergic. This is what is our topic today. We are going to discuss about the anticholinergic nervous system. So when we discuss about the anticholinergic nervous system, that means it is going to act like it's going to inhibit the parasympathetic activity. This is going to inhibit the parasympathetic activity. That means it is going to be like it's going to be like sympathetic nervous system. Okay, this is going to activate. See, it won't like go activate sympathetic nervous system, but as it is going to inhibit your parasympathetic, we also call this as parasympathetic. We call this as parasympatholitic. We call this as parasympatholitic. Lytic means for against, inhibition, okay, breaking down. So breaking down the parasympathetic nervous system or blocking the parasympathetic nervous system is what the function of this anticholinergic drugs. And same thing if we talk about the cholinergic drugs, these are called as parasympatho. These are called as parasympathomimetic. We call this as parasympathomimetic. Now, why are calling it mimetic? Because it mimics this one which is there, the cholinergic drug system which is there. This is going to mimic the activity of the parasympathetic nervous system. So this difference is very important. Okay, you have to understand about the difference over here. So parasympathetic nervous system, we are mainly going to have your cholinergic drugs and your anticholinergic drugs, and these anticholinergic drugs are the ones which are going to inhibit the acetylcholine. Okay, so let's try to understand in a very simple way what is going to happen with the help of an example or with the help of a meme. Okay, so usually what happens is, okay, this girl who is there, she is going to be the ectopet, or this is going to be, you can say, your girl best friend. Okay, and this is you, or this is me, you can say. Okay, now what happens over here is that acetylcholine usually goes and binds with the muscarinic receptors. Acetylcholine binds to the muscarinic receptor, and because of the binding to the muscarinic system, it shows your which system, which activation. It shows the activation of parasympathetic nervous system. But now this atropine which is there over here, because of the presence of this atropine, this acetylcholine cannot leave atropine. Okay, atropine will go and bind with acetylcholine, or it's going to go and inhibit the acetylcholine to go and bind with the muscarinic receptor. This is what your atropine or anticholinergic drug is going to do. Anticholinergic drugs, which is there, example ibuprofen, will not allow the acetylcholine to go and bind with the muscarinic receptor. So if acetylcholine doesn't go and bind to muscarinic receptor, what is going to happen? The muscarinic activity will not be seen, right? Like the last time we discussed, the cholinergic activities which are there in the body, they cannot be seen. As simple as that. So let's try to understand with the normal introduction. Acetylcholine wanted to party, but anticholinergic said no. So these are also called as parasympathetic. Now, as I told you, these are the class of medications which are going to mainly going to go and block the muscarinic receptor, the nicotinic receptor. It won't allow the acetylcholine to go and bind with the muscarinic and nicotinic receptor. Very simple. I've already explained this, right? So I'm just explaining you and just giving you notes also here on, so that you don't need to search for notes anywhere for examination purpose. So now this results in a physiological activity, particularly it activates the parasympathetic nervous system. That's what we discussed, right? The activation of parasympathetic nervous system, also called as rest and digest function. So now mainly the actions of your acetylcholine is to decrease the heart rate, increase the GI mobility. Then you can say it's going to help in increasing the secretion. But these anticholinergic drugs are going to exactly have the opposite actions or opposite pharmacological action compared to your acetylcholine. So what is this anticholinergic do? Yes, anticholinergic is just going to go block. It's going to block everyone. It's going to block the acetylcholine and will not allow the acetylcholine to go and bind with the muscarinic or nicotinic receptors. So I hope it is clear. So it's like this is what anticholinergics do to acetylcholine, just like how your ex did to you. Okay, let's go. Let's not get personal. Let's go ahead. So let's try to understand the classification of your antimuscarinic. See, we are having two, that is your antimuscarinic and antinicotinic. In this lecture, we are mainly going to deal with the antimuscarinic agents. We are mainly going to deal with the antimuscarinic agents. So this antimuscarinic agent, we are mainly classifying into three types. That is going to be, first is going to be a natural alkaloid. First is going to be natural alkaloid. Then you are going to have your semi-synthetic derivatives, and then you are going to have your synthetic derivatives. So if I talk about the natural one, that is nothing but you're mainly going to have the belladonna. You're going to have the belladonna alkaloids. Okay. So mainly belladonna in pharmacology, so we have studied the belladonna which is there. It's mainly going to consist of your atropine, and scopolamine. So these are the drugs which are going to come under the natural alkaloids. These are the drugs which are going to come under the natural alkaloids. Okay. Then you are going to have the semi-synthetic one. See, these are naturally acquired, right? Like from the banana plant. Now the semi-synthetic which is there, that is nothing but the like addition of some chemical agents or addition of some derivatives, chemical derivatives, which will help in the pharmacokinetic aspect, you can say, or mechanism of action. In that we are mainly going to have your isocyane. We are going to have isocyane, butyl bromide. Then you can have your ipratropium bromide. Okay, so two examples you can remember over here of your natural, and then you are going to have your semi-synthetic derivatives. Then you are going to have your synthetic derivatives. Now these synthetic derivatives which are there, they are going to classify mainly based on the What is the therapeutic activity? We're mainly going to classify this synthetic agent based on the therapeutic activity. So those anticholinergic drugs which are going to be used as in the help of your ophthalmology or your eyes. Okay, this is the SNOSI. Just try to recall when I discussed about your cholinergic system. This was causing miotic. This was causing miotic. Okay, and whereas if we talk about anticholinergic system, this is going to cause mydriasis. This is going to cause your mydriasis. You can remember like C for cholinergic system, C for meiotic, and then even C which is over here, okay, C which is over here, it can stand for constriction of the pupil. This will stand for constriction of the pupil. But whereas your anticholinergic system, you are having a D over here, this will stand for dilation of pupil. This is going to cause dilation of pupil. Okay, is it clear? So mainly we are going to have based on the mechanism of mainly because therapeutic activity, you are going to have your mydriatic compounds, those drugs which are going to cause mydriasis. Then we are also going to have the drugs which are going to be helping in the peptic ulcer, which is going to help in the treatment of peptic ulcer. Then we are going to have the anticholinergic system, which is going to act as antispasmodic. We are going to have antispasmodic, and then later we are going to have the drugs which are going to be helping us in the pre-anesthetics, and then we are going to have the drugs which are going to help in treating the Parkinsonism. Okay, they are going to help in the treatment of Parkinsonism. So to detail you understand. So I have given you an overview classification. It comes for 5 marks something. So this is how you're supposed to classify your antimuscarinic. Even you're going to have anti-nicotinic ones that will go ahead and try to discuss about that. So as I've just written over here, then you're going to have the classification of antimuscarinic agents over here. First is going to be natural alkaloids, then semi-synthetic derivatives, then the synthetic antimuscarinic agents which are going to be used as mydriasis, then peptic ulcer, then you're having antispasmodic, pre-anesthetic agents, and Parkinsonism. Just try to understand with some mnemonics to understand the drugs which are going to help in mydriasis, peptic ulcer, antispasmodic, and your pre-anesthetic and Parkinsonism drugs. So, mnemonics for the drugs which are used in ophthalmology, you can remember TASK. Okay, TASK, TASK. T stands for tropicamide, which is used in mydriasis. A stands for atropine, which is used in pupil dilation. S stands for your scopolamine, and K is a condition. It's not a drug. No, K is not a drug. It's a condition called as keratoconjunctivitis. That means what is keratoconjunctivitis? Inflammation of the conjunctiva. Okay, inflammation of the conjunctiva. Okay, so for those we are going to use these drugs which are called as your tropicamide, atropine, and scopolamine. You can remember it with the mnemonic called as TASK. Okay, fine. So the next mnemonic which you can remember is the bot. Okay, you know have Chat GPT bot, right? So that bot you can remember with this. That is mainly your for the overreactive bladder. So these are going to be acts here antispasmodic. These are going to be act as antispasmodic. So what does overreactive or overactive bladder means? That the patient will be undergoing frequent urination. The patient which is there will be undergoing frequent urination. So to prevent the frequent urination or to decrease or to prevent the frequent urination, we are mainly going to have here antispasmodic. So as you remember, the cholinergic system we talk about or parasympathetic nervous system we talk about, this is going to cause urination, right? It's going to help in the urination form, right? But whereas if you compare yours now, what is this anticholinergic drug going to do? What is this oxybutynin and calcitonin going to do? It's going to go and then reduce the urination or it's going to reduce the diuresis by blocking the cholinergic system. By blocking the cholinergic system, it is going to block the parasympathetic nervous system, and because of which it's going to decrease the urination. It is going to decrease the urination. This is what your overreactive bladder or antispasmodic means. Now, if we talk about the anticholinergic drugs used in pre-anesthesias, okay, for that we are mainly going to have atropine. We are going to have an atropine and your glycopyrrolate. Now, if we talk about the atropine, this can enter the mainly your CNS, whatever the blood-brain barrier is there, right? Blood-brain barrier. So this can enter the blood-brain barrier, and because of which this is going to have CNS effects. In smaller dose, it is not quite significant, but if you are giving the atropine at higher doses, it can affect or it can cause hallucination. It can cause hallucination. or it can cause your delirium. Okay, but whereas if you talk about glycoprolate, it's similar to your atropine, but with fewer side effects, but with fewer CNS effects, not side effects, with fewer CNS effects. Okay, let's go ahead. So what is the mnemonics which is used in anticholinergic drugs? You can remember Ben and Tri help Parkinson. So that means benzotropine and triacylphenidine. So if you talk Parkinsonism is nothing but your dopaminergic system which is there, or dopaminergic nervous system which is there, it is not working. Okay. So if you talk about dopaminergic, okay, try to understand it very short over here. Dopamine which is there, inhibitory it is a inhibitory neurotransmitter. It is a inhibitory neurotransmitter. But now what happens that this dopaminergic nervous system or dopaminergic system doesn't efficiently work, so which leads to decrease in the dopamine. So if dopamine is decreased, what happens? The concentration of your adrenaline or concentration of your excitatory neurotransmitter, not ENT is not ear, nose, throat, okay? Excitatory neurotransmitter, the concentration of this increases. Because of this, it leads to the activation or it leads to the hyperactivation of the nervous system, which can lead to the symptoms such as your tremors, muscle movements, abnormal movements, right? So all this is what is Parkinson's. So, what are we going to do? What is anticholinergic system going to do? It is going to inhibit the activity of acetylcholine, but it's going to inhibit the activity of your acetylcholine. So, if you inhibit the activity of acetylcholine, it's going to cause here. What is it going to cause? It's going to cause relaxation to the brain. It's going to cause relaxation to the brain. Okay. So I hope it is clear. So Benz and Tri help Parkinson over here to treat the Parkinson. It's going to help in treating the Parkinsonism disease. That is your benzotropine and trihexyphenidyl. Now let's try to recall the code which is over here. So one simple code you can make over here. You can be like Benz and Tri helped Parkinson. Okay, Benz and Tri helped Parkinson. For what they helped? They helped Parkinson to complete the task bot. To complete the task bot at gas. At gas. So Benz and Tri helped Parkinson, okay, to complete the task bot at gas. So you can remember this. The mainly it's going to be your benzotropine and triacylphenidine, which is going to be used in your Parkinson disease. Then you are having what is the drugs which are there over here? Propylamide, atropine, scopolamine for your keratoconjunctivitis. Then you are mainly going to have your like bladder related oxybutylene, and then your oxybutylene, and then you are going to have your tolterodine over here, and then at gas, that means atropine and glycoprolate, which is there for the anesthetic, or you can say it is going to use as a pre-operative surgery. This bot which is there, this will be mainly used for the hyperactive bladder activity, and this is mainly used in the ophthalmology. This is mainly used in ophthalmology. So by this you can remember your classification. Okay, by this you can remember your classification: natural, semi-synthetic, synthetic. And then if you talk about natural, you're going to mainly have your atropine, then scopolamine, and then your semi-synthetic, you can remember ipratropium bromide, your homotropine, all these things you can remember. Ipratropium, tiotropium bromide, easy to remember. Then in synthetic, you're going to have your Parkinsonism for ophthalmology, then for your hyperactive or antispasmodic, and then as a pre-anesthetic drugs. So this is the classification which you can remember for your examination. So this is a very easy way, because see at the end now what happens is, as there are many classifications, you will get confused. Okay, it's very easy. It's a tendency to forget the text. So you can just remember this. Benz and Tri help Parkinson for what? To complete the task bot at gas. Okay, right. So let's try to understand the mechanism of action. So it's very simple. This, my dear acetylcholine, what it goes, it tries to go and proposes this M2 receptor, or muscarinic receptor. But this best friend of your M, that is your atropine, is not going to allow this acetylcholine to go and bind with the M receptor. Okay, this is what happens. Now, what happens if acetylcholine doesn't bind to M receptor? If acetylcholine doesn't bind to M receptor, your parasympathetic nervous system will get deactivated, or parasympathetic activity or muscarinic effect will not be seen. That's why this is also called as anti-muscarinic agents. Okay, it's also called as anti-muscarinic agents. So it competitively is going to inhibit the muscarinic receptor, no parasympathetic drama, and it's going to organs are going to go dry and chill, right? So there's no, like, why did I say dry and chill? Because obviously when I'm telling there is no like secretions, okay, when there is no secretions, your mouth will get dry, right? This is what the anticholinergic system is going to do, right? So it's going to deactivate, or it's going to deactivate your parasympathetic nervous system. So I hope till now the mechanism of action is very clear. Let's try to understand the uses. First uses over here is mydriasis. I told you it's going to help in dilation. Then even cyclopegia, which also is going to be used. Then it's used in COPD asthma. That's erythrotropium is an example. Then I told you overreactive bladder, oxybutynin. Then you're going to have Parkinsonism, triacylphenidine. Then bradycardia. Okay, bradycardia also is going to help. Ectopin, which is there, is going to. It's a very major drug which is used in the bradycardia. Okay, so here in the previous slide, if you saw, the activant might look like a villain, right? It is not allowing, or it's not the love story of acetylcholine receptor. It's going to act like a third wheel and not looking like a villain, right? But in childhood, we always loved the hero, but then we understand that villains are too there, right? But now we understand villains too. We can understand what is this villain is going to help us, right? So this ectopin which is there is just like a villain which is not anyway going to allow, or which is not anyway going to allow the love story of acetylcholine and M receptor. Okay, fine. So now we are going to understand about the pharmacology of ectopin. We are going to understand the pharmacology of ectopin. Try to understand first the mechanism of action. First, the mechanism of action. What is going to happen over here? Try to understand. This is your nerves, and then here you are going to have your acetylcholine. Here you are going to have your acetylcholine, and this over here, this is a this is a muscarinic receptors. These are your muscarinic receptors. So usually what happens is that acetylcholine will be released and will go and bind with the muscarinic agents, and then it is going to show the parasympathetic nervous system activation, right? It's going to show the muscarinic effects. It's going to show the muscarinic effects. But now what happens over here is that your ectopin which is there, this is going to block this. It will not allow the acetylcholine to go and bind with the parasympathetic nervous system, or go and bind with the M receptors or muscarinic receptors. Okay, so as it does not go, and does not allow acetylcholine to go and bind with the muscarinic receptor, it will inhibit the parasympathetic nervous system stimulation. This is going to inhibit the parasympathetic nervous stimulation. So this is what is the exact mechanism of action of this drug. So now let's try to understand what is the pharmacological effect. What is going to be the pharmacological effect on various parts of the body? Okay. Okay. Let us start with the central nervous system. Okay. Let us start with the central nervous system. So as I told you that this is going to cross your blood-brain barrier. Okay. This is going to cause your blood-brain barrier. So usually if you see, it's not going to have much action at low concentration. If the concentration is less, it is just going to have mild symptoms. Mild symptoms can be seen, or mild effects can be seen, such as your sedation. It can cause sedation, okay? Or you can take, but now if you're taking in higher concentration, these drugs which are there, they can cause hallucination. They can cause hallucination and delusion, and your delusion. But this is only at the case of higher concentration. But at normal concentration or low concentration, it has mild symptoms such as sedation. So this is what is the effect on your central nervous system. Right. Let us try to understand what is the effect on the cardiovascular system of this patient. What is the effect on cardiovascular? So mainly, this drug which is there, this is going to increase the heart rate of the patient. Okay. So usually I told you, right? Cholinergic system means what? It's going to decrease the heart rate. But this is anticholinergic system, which is going to inhibit the activation of acetylcholine. So it will increase the heart rate. So increasing the heart rate, this is called as your chronotropic effect. This is called as the chronotropic effect. And then if you see, it's going to increase the AV conduction. It is going to increase the AV conduction, and that's why it is also called as dronotropic effect. This is going to show okay, not drono, bromotropic effect. Okay, So on the cardiovascular system, it's going to increase the heart rate and the AV conduction. So overall, this one which is there, this activity of your atropine or this activity of anticholinergic drug is useful in the case of the patient having bradycardia. This is used for the patient having bradycardia or asystole. Asystole means the heart doesn't function in this case. Okay, the heart doesn't function. So this drug which is there becomes very important in case of treating bradycardia and asystole. So I hope the cardiovascular system is clear. I hope the function of the in the cardiovascular system it is clear. Now let us try to understand what is the effect of this drug in the what is the effect of this drug in the respiratory system. Let's try to understand its effect on the respiratory system. So this drug which is over here, this is going to decrease the bronchial secretion. This is going to decrease the bronchial secretion because the main thing of your autonomic nervous system is talk about your parasympathetic. That means secretions is going to enhance, right? But this anticholinergic drugs which are there is going to decrease the bronchial secretions. Okay. Then what else it's going to do? It's going to relax. It is going to relax the smooth muscles of lung. It's going to relax the smooth muscles of lung. So because of this property, these drugs which are there, these are used in case of treating your COPD and asthma related condition. COPD and asthma related condition. Okay, because it's going to decrease the bronchial secretion and relax the smooth muscle. Okay, these drugs which are there. So we understood till now the CNS effect, which is going to cause a mild sedation. Then we understood about the cardiovascular effect, which I told you it's going to help in the treatment of bradycardia and asystole. Then we also understood that how this drug is going to help in treating the COPD and asthma related diseases. Okay. Now let's try to understand what is the how is this drug going to help. Okay, I'm extremely sorry. Yeah. How is this drug going to help in treating of your GI system? Let's try to understand how it is going to help in treating of your GI system. So this drug which is over here, this is going to, it's going to inhibit the gastric acid. Now again, secretions, right? So it's going to reduce the gastric acid secretion. This is going to reduce the gastric acid secretion, and it is also going to reduce the GI motility. This is also going to reduce the GI motility. Because of this property, this is going to be used in the case of your peptic ulcer. Because peptic ulcer is why? What is peptic ulcer? It's going to be ulceration of the GI wall or the mucosal lining. Then there is going to be increased secretion of acid, right? So when there is increased secretion of increased gastric secretion, okay, because of indigestion or any other causes, this can cause your peptic ulcer. But this drug which is over here, this is going to decrease the gastric acid secretion, reduce the GI motility, and that is why this is usually used in the peptic ulcer. Okay, though this is not the first line treatment we give, but yeah, in the later on treatment we can give, because if you give in first line, this is having a lot of the side effects also, right? So we have other better drugs which can be helping peptic ulcer, but in later treatment, if that doesn't work, we do have this option of giving atropine as the anti-peptic ulcer agent. Okay, fine. Next is going to be your atropine. Next is going to be your in the ophthalmic, as nothing but the eye. How is this going to help in the eye over here? So if we talk about the eyes, if we talk about this thing, anticholinergic drug which is there, this is going to cause your mydriasis. This is going to cause your mydriasis and your cycloplagia. It's going to cause your mydriasis and cycloplagia. What is mydriasis? I told you D stands for dilation. D stands for dilation of pupil, which is the dilation of the pupil. And cycloplagia means paralyzes the accommodation. This drug which is there, it paralyzes the accommodation of the eye. It paralyzes the accommodation of the eye. So because of this property of pupil dilation and cycloplagia, this is mainly used for eye examination, or whenever they're going to examine the eye, they're going to put the few drops of this so that everything, it paralyzes the accommodation. So it's going to be help in the treating, it's going to help in eye examinations, okay, mainly in the eye examination. Okay, fine. So these are the major uses. Okay, these are the major uses which I have discussed. First is your CNS effect, then your cardiovascular effect, then your respiratory effect, and then your GI or the GI effect, and then the last, but not the least, that is your ophthalmic effect. So these are the pharmacological effects, the general pharmacological effect over here, which is going to help. Okay, one more effect can you tell? One more effect can you tell about the urinary bladder? Okay, we discussed about the urinary bladder over here. What is the bladder effect? We already discussed over here. Bladder effect. It is going to reduce the bladder activity. It's going to reduce the bladder activity. So these are the various pharmacological effects of atropine on the human body. Okay, let's go ahead. So this is just the whatever I explained over here in short. This is just in detail for your notes purpose. You can use it in when I provide the lecture. You can join a Telegram channel also, so you can get all you can access all these notes for your understanding and okay. So now we have understood the mechanism of action. Okay, we have till now understood the mechanism of action. We have understood the pharmacological action. Let us try to understand the kinetics of this drug. Okay, so ectopin, which is there, okay, is mainly absorbed into the GI tract. Is mainly absorbed into the GI tract. Then it is having a well distribution. Okay, it's going to have well distribution. It's going to go to the different parts of the body. Okay, and then it's can main thing to understand about this is that it can cross your blood brain barrier. It can cross your blood brain barrier. Okay, comparatively if you see, it is to some extent, but yes, it does have an ability to cross the blood brain barrier. Okay, after crossing the blood-brain barrier, it can be absorbed into GI tract. Well absorption is in the GI tract. Okay, and then it is going to be metabolized. It is going to be metabolized in the liver. It's going to be metabolized in the liver with the help of an enzyme called as CYP450 enzyme, cytochrome P40 enzyme. Okay, this is the metabolism of this drug, and then it is excreted in the urine. It is excreted in the urine. Simple metabolism. Okay, kinetics at always remember same thing is that it's going to be absorbed in the GI. But one characteristic thing which you're supposed to know in this atropine is that it can cross or it has a significant, like a bit prominent effect that can cross the blood-brain barrier, metabolized in liver with the help of CYP450, and then in urine it is going to be excreted. It is going to be excreted in the form of metabolites. It's going to be excreted in the form of metabolites, or sometimes it remains. Sometimes it remains unchanged. Sometimes it remains unchanged. Okay. So I hope the kinetics of this drug is very clear. I hope the kinetics of this drug is very clear. So you can see the kinetics which is written over here for your examination purpose. Yeah, this is what it is. This is what it is in a simple way. So try to understand and learn it here on GI tract, blood-brain barrier, metabolism, liver, urine excretion, metabolites in the form of metabolites, or in the form of your, it remains unchanged. Okay. Right. So I hope it is clear. This is the same thing. Then, what are the adverse effects of this drug? This drug when taking, you can't pee, you cannot see, you cannot spit, you cannot poop. Just remember this. Adverse effects are can't pee, can't see, can't spit, can't poop. Because this is going to cause dry mouth, as I told you, salivary secretions are going to be decreased, that is xerostomia. Then I told you mydriasis, blurred vision. Then this drug which is there, if you're given higher amount, this can cause tachycardia. This can cause tachycardia. So see, this is used for treating bradycardia, but if you're giving in high dose, this can cause tachycardia. Okay. Now, as I'm going to decrease the bladder activity, this can increase or this can cause urinary retention. Then even the GI motility is decreased, so this can cause constipation because the GI motility has been decreased. Right? Now here this is your mydriasis because of mydriasis. Then here dry mouth, this is because of decreased salivary secretion. Decreased salivary secretion. Then I told you a CNS effect at higher doses atropine can cause confusion, delirium, hallucination. Now this can cause increase in temperature. Now why increase in temperature? Because my sweat glands which are there, my sweat will be decreased. My amount of sweat or sweat glands will not be able to produce sweat, because of which my body cannot be helping in controlling my body temperature. So because if there is heat outside, this can cause hyperthermia or increase in the body temperature because sweating does not take place in this particular drug or when you take this drug. Okay, so I hope it is clear. Right. So let's try to understand the contraindication. So especially glaucoma, as I'm going to cause, is going to cause dilation, right? So in case of glaucoma, if you're giving this drug, this can cause or this can make the pressure reverse. Okay, that's why you usually don't give this drug in the case of glaucoma. Then prostatic hypertrophy, as I told you, bladder activity is already less. Bladder activity is less means what? Urinary retention is going to happen. If there is urinary retention is going to increase. So if urinary retention is increased, this is going to apply a force or apply pressure. It's going to apply pressure on prostate gland. Already because there is a pressure on prostate gland, this is going to lead, or this can have a chance of increasing the prostatic hypertrophy. This can lead to prostatic hypertrophy. So those patients who are having prostatic hypertrophy, we are giving it, then what's going to happen? Hmm. What's going to happen? Obviously, it's going to exaggerate, right? It's going to exaggerate the condition. Then, similarly, I told you we should not supposed to go to elder with confusion. Who are going to have confusion, we should not be giving this drug because this can enhance the blood-brain barrier, right, and can cause sedation. Can cause sedation and maybe hallucination and delirium if it is given at higher concentration. Now, last but not the least, let's try to understand the drug interaction of atropine. The anticholinergic drugs which are there should not be given with antihistaminic because antihistamines which are there, these are also going to help, or these are also going to decrease the secretions. These are also going to decrease the secretion, and even anticholinergic drug is going to decrease the secretion. Because of this, you are going to have double dryness. Because this, you are going to have double dryness. And if we talk about over here about the anticholinergic with tricyclic antidepressant, I told you anticholinergic can cross the blood-brain barrier and it can cause sedation, right? It can cause sedation, delirium, and all these things. What are these antidepressants going to do? These are also going to cause the same thing. So because of which this can lead to brain fog or overload, too much confusion to the patient. Okay. So as I told you, too many blockers will always spot the show. Okay, too many blockers are there will always be spoiling the show. For example, anticholinergic and antihistaminics both are going to decrease the secretion. If we talk about anticholinergic and tricyclic antidepressant, both are going to cause the sedation. So because of this, too many blockers are always going to spoil the show. So I hope today's lecture was easy understanding. Okay. In our upcoming lecture, we'll be understanding about the adrenergic agonist when adrenaline goes full starvage. Okay. But till now, I hope it's very clear. We have discussed about the cholinergic nervous system and anticholinergic nervous system. The important question for your examination is classify anticholinergic system and write down the pharmacology of your atropine. And the same question for your cholinergic system is what classify cholinergic system and write down the pharmacology of acetylcholine. These two are the very major question. It can come either as 10 mark or 5 mark in the Pharm D and B Pharm examination. Thank you everyone for listening so patiently to my lecture. Hope you are liking it. Keep liking, subscribing our channel and do join our Telegram channel for the further notes and updates of the upcoming video. Thank you everyone.